Hi, good morning, everyone. Oh, there we go. Hi, good morning, everyone. My name is Michael Weezar, and I just want to welcome you all to today's TA Marketplace Vendor Fair. We're really excited that this is the first vendor fair that we've held, and we're really excited for what the outcomes may hold. We can go to the next slide. So just letting you know today who we have from DHCS and Public Consulting Group. There's myself. We'll also have the team from the PATH unit, which is Shell Wong, who's the section chief over the project coordination section, and Jasmine Garcia, our unit chief over the actual PATH unit. And then joining us from Public Consulting Group, we also have Trish Parazelli, the TA Marketplace lead. We have Eliza, our vendor services lead, and Jenna, the cross work stream lead, and finally Danielle Feldman, who's the TA Marketplace project manager. So that's who you have from the third party administrator, as well as the department on the line today. We can go to the next slide. So for today's level setting, we just wanted to highlight that the vendor fairs today and future forward provide an opportunity for vendors to share information about their organization and the services that they can provide to potential TA recipients, and support the utilization, more support of the utilization of the marketplace. We're going to have a total of 5 virtual vendor fairs that will be held between this one today as well through April, split across the different domains, the 7 different TA domains on the marketplace. So our goals for today will be providing an orientation to the vendor fairs, what they'll look like. We'll also be showcasing the TA vendors and their services and projects. We'll be sharing the TA Marketplace resources and updates, and finally opening for Q&A. So that will just give you a glimpse of what we'll be looking at for today, and just highlighting also that in addition to today's activities, we just wanted to also highlight that in collaboration with PCG, we've made significant updates to the marketplace to make it more user friendly, to improve just the visibility and the optics of it, as well as just make overall enhancements for the end user. So we're really excited and hope that will also just make accessibility for TA services just more friendly for everyone. And we're really just excited to for both vendors and participants to also just learn from each other about what services are available, and so that they can inevitably connect and really just lift up and work more in these spaces of CalAIM, specifically for enhanced care management community support. So really just excited for what's ahead, and really hope that this is something that is helpful for everyone. And of course, at the end, we do certainly want to know how we can improve or make the future vendor fairs better, or just ways that we can improve overall. So I will land there and transition it to the next speaker. Thank you all so much.
Thank you so much, Michael. Hi, everyone. I'm Jenna Wall. I just want to give a very brief high-level agenda for our plan for today. So we are currently doing the welcome and introduction. Following that, we will have the vendor pitches for about 30 minutes. Each vendor has about 1 minute to present. Then we will be moving to breakout room sessions where you will be able to engage in conversations with a smaller group of vendors, ask more specific questions of those vendors, their services, and projects. And finally, we will close with a general Q&A about the TA Marketplace, provide some updates and overview of the website, and just some closing remarks. Next slide, please. All right, so just some Zoom logistics. We did share this in all of our communications, but please be sure that you have the Zoom application downloaded to your device. Be sure that you are not joining via a browser. And the reason for this is that at this time, the Zoom webinar does not permit you to join the breakout room sessions through a browser. You must have the application. So if you have not already joined via the Zoom application, you can use this link, the zoom.us/download, to download that and rejoin the meeting. Additionally, you will see the Q&A at the bottom of your screen. You can use that functionality to ask just general inquiries regarding the TA Marketplace or any technical issues that you are experiencing. However, we do ask that you hold your vendor-specific questions for those breakout rooms. So please just share any questions you have in general, and we'll be sure to have those for the session at the end of today. Next slide, please. All right, and we're going to start with some vendor pitches. I'm just going to give a brief overview of that. All right, so we have 20 vendors here with us today. They are all vendors that are approved for Domain 3. So they will be presenting in alphabetical order. Each vendor has 1 minute to present their organization, and there is one representative that is giving that presentation. Again, just want to share that we ask that you hold those vendor-specific questions for the breakout room sessions. And again, that's going to be a really great time to engage with those specific vendors and ask more about their services. All right, so I think we can go to the next slide, and we're ahead of schedule. So I'm going to hand it off to our first vendor, which is 43 Strategic Consulting.
Thank you, Jenna. Hi, my name is Jenny Azara. I'm representing 43 Strategic Consulting today. 43 Strategic Consulting is a woman of color owned and led company founded by my colleague, Catherine West. 75% of our team identifies as a member of historically marginalized community, and our approach is grounded in principles of equity leadership. We are a collective brain trust of consultants who have deep experience in leading mission-driven and community-based organizations, and we have a proven track record of facilitating collaborative partnerships across diverse agencies. Our team includes practicing clinicians and experts in Medicaid, in housing, health, social drivers of health, care management, value-based care, payment, digital equity, and more. I just want to say that I was drawn to work with 43 Strategic Consulting because of the opportunity to collaborate with innovators motivated by social justice and to improve the health and well-being of individuals and families living in historically under-resourced communities. I want you to know that our commitment is to ensure that the organizations we work with improve their revenue to sustain their mission and impact. And I really encourage you to visit our website or come to my breakout so that we can talk some more about how we could partner together. Thank you so much.
Thanks, Jenny. All righty, that was our first vendor, and we're now moving to Apps Global.
Thanks, Jenna. Good morning, everyone. I'm Laura Forbes from App Global. We're a consulting firm with a 60-year history focusing on improving the quality of life and economic well-being of people worldwide. We've developed a similar technical assistance program in Massachusetts to help CBOs implement health reform. And apart from that, we have decades of experience providing training and TA resources and support for a diverse array of community-based TA recipients across all kinds of topics, health and housing and human services. We have developed a very flexible and responsive approach to designing and implementing training in TA, and we've been qualified by the state to support organizations across all 7 domains. In Domain 3, we can support local organizations in identifying the areas in which they need to build capacity, in establishing the infrastructure needed to implement enhanced care management and community supports, and in scaling up the services they provide to Medi-Cal beneficiaries to meet that greater demand that we expect will be generated with formal MCL relationships. So I look forward to speaking with you further in breakout room 3. Thanks.
Okay, thank you so much, Moira. We can go to the next slide, where we have Blue Path Health.
Good morning. I'm John Weir with Blue Path Health and appreciate the opportunity to speak with everyone this morning. Blue Path Health specializes in strategy, policy analysis, program planning, and execution, along with technology and data sharing projects to build community partnerships across the healthcare landscape. While we provide services in multiple domains and have seen a lot of work in Domain 1 and Domain 6 in particular, we do have strong experience in working with MCPs and helping organizations in that environment. Our work with MCPs, provider organizations, county agencies, CBOs, and health and care information organizations encompasses a flexible and hands-on approach to helping each constituent include their ECM and CS services to ensure that they're meeting the operational needs of the program. We typically anchor ourselves in healthcare equity and access as 2 drivers to our projects. And we try to leverage those to ensure that contracting, patient access, reimbursement, and operations are optimized to meet staff capacity needs and focus on the clients We have a history of being catalysts for positive change in the state, and look forward to working with folks as we continue along this landscape. You can join me in room 6 for more information.
Thanks so much, Sean. We can go to the next slide, which is California Health Policy Strategies.
Hi there, Gretchen Schroeder, California Health Policy Strategies. Thank you so much for having us today. We are a Sacramento-based consulting firm, and we have a lot of experience working to improve California's healthcare system and in serving vulnerable populations. Our team includes folks who have worked for Medi-Cal managed care plans and really understand how they view the world and how they can approach these programs. We also have folks with a lot of health policy experience, so helping to interpret all of the health policy coming down from the state and how to make that work for your organization. And then I have a lot of CalAIM experience. Started out with whole person care and have evolved into ECM and community supports, and just love working with folks to set up, implement, and manage their ECM and community supports programs. We do have specific expertise in working with organizations around street medicine, dual eligibles, and the justice involved population. And we would love to work with you. We will be in breakout room number 1. We'll hope you'll join us. Thank you.
Great. Thanks so much, Gretchen. We can move to the next slide, which is Chapman Consulting.
Thank you. Good morning, all. Athena Chapman with Chapman Consulting, and we are a small but growing woman-owned consulting firm also located in Sacramento, California. We have done a lot of work around strategic planning, project management, operational support, and stakeholder engagement in many areas, and have been involved in CalAIM as it was being developed and pre-implementation, some of the precursor programs, including the Coordinated Care Initiative and Medi-Connect, sort of building on that managed long-term services and supports regulatory and operational structure that is now enhanced care management and community supports being launched statewide. So have a long history working both with the department and at the department in the past. And we have a team of folks that have worked with provider organizations, community-based organizations, health plans, and we have been doing projects related to enhanced care management and community supports implementation since CalAIM was first being developed, and really have been following some organizations through that, trying to make it as simple as possible in sort of getting through a lot of the complex regulatory and operational requirements and figuring out where organizations can fit in. As you can see, we're obviously here for Domain 3. We're also approved for Domain 6, and we have some off-the-shelf resources as well. And we look forward to hearing more from folks in the breakout room. So thank you.
Great. Thanks so much, Athena. All right, we can go to the next slide, which is Cope Health Solutions.
Morning, folks. I'm Evan King, a principal and founder of Cope Health Solutions. I'm really pleased to be here today and be part of the CalAIM process. We are a national advisory firm focusing in value-based care with deep experience here in California, where we were really born. Over the past 20 years, we've worked in pretty much all the Medicaid waivers here in California, even pre-district back and coverage initiative, across the state in multiple counties, both rural and urban. And I think one of the key things that we feel is important about CalAIM is how we make this program sustainable. And part of that is working with your payers closely so that it's not a one-time grant-funded opportunity, but something we can really align with our operations and overall strategy so that these services can really sustain in the managed care model going forward. We are approved for all the domains. In this case, for Domain 3, we worked with a number of plans, both the national and regional plans in the state, with contracting, developing innovative payment models, but likewise helping organizations think about what are my staffing requirements? How does it fit into our overall strategy? Thinking through how we're going to scale over time and putting into place the requirements so that we can, one, meet the needs of CalAIM, but also, again, making sure that we're responsive to both the population needs managed care plans, as they each have unique needs by county. We're really excited about talking to you later today. I'll be in breakout room number 8, and hope you'll have a good afternoon.
Hey, thanks so much, Evan. You can go to the next slide, where we have Corporation for Supportive Housing.
Good morning, everyone. It's good afternoon here. I'm in New York City. My name is Eva Lerner. I'm a senior consultant with the Corporation for Supportive Housing. We are a national champion for supportive housing. We leverage the potential for supportive housing to improve the lives of historically marginalized individuals and families that are experiencing housing instability and homelessness. And our strategy includes strengthening the field through training, technical assistance, thought leadership, investing in supportive housing and the quality of supportive housing, aligning with services to accelerate systems transformation, as well as engaging in policy and advocacy to act as a change agent to advance policies and strategies that promote thriving communities with housing and services at the center. So we are approved for domains 2, 3, and 6, but today to talk about what we can offer for domain 3, we're really targeting providers of supportive housing who are interested in leveraging the CalAIM benefits for those critical community supports. And we have a number of customized and off-the-shelf products, including our Medicaid 101 for community providers that provides the gamut of training and technical assistance that can support you in learning how to contract with managed care plans, understanding Medi-Cal compliance requirements, blending and braiding funding, etc. And we approach all of this work through an equity and anti-racist lens. So we will be in breakout group 2. I hope you join us. Thank you very much.
Thank you so much. All right, we can go to the next slide where we have Evaset.
Good morning, everyone. I'm Julie Lawrence, the CEO of Evaset, and we hope you will come to Evaset's breakout room so we can get to know each other. We are a very motivated CalAIM TA provider. We've been here since the inception. We've got 18 projects in various stages covering more than 20 counties. We are Stanford trained, very hardworking, and pride ourselves in being easy to collaborate with. So we and all the other fantastic vendors here share a strong background in engaging in CalAIM through Medi-Cal managed care. I just want to highlight 2 unique specialties for us, and happy to talk more about the broader competencies in the breakout room. So the 2 unique specialties I want to highlight are, number 1, data. We specialize in showing you how to use data to identify ECM and CS market opportunities and risks for your organization. And we also use data to support you with benchmarking and a method for proving with data your organization's specific value to managed care plan partners. Our second unique specialty I would highlight is strategies for financially sustainable growth for social care providers, ECM and CS, in the new CalAIM environment. We can help you incorporate industry-leading market intelligence and also help you increase volume of referrals. Would love to share more and hope to see you in breakout room 8.
Thanks so much, Julie. We can move now to the next slide. And
Good
we have
morning.
Oh, there you go, John. Go right ahead.
No worries. Good morning, everyone. I'm John. I'm a pediatrician and the founder and CEO of Just Whole Care. And I started Just Whole Care because healthcare is hard and inequitable. I don't need to tell anybody here that. Resources are often sparse if you don't have the knowledge, network, or data to get paid. But the truth is, if you could grow seamless, equitable, trauma-informed healthcare across delivery systems and payers, particularly managed care and county behavioral health plans, which couldn't be more different, you could really make a tremendous change. That's where we step in. We developed the business plan for integrating behavioral health and parenting supports in pediatric primary care. I co-chaired the crisis care continuum of LA County's mental health plan, which got officers out of mental health situations in our communities. And I've helped scale ACEs screening and 988 with state and other funding. Reach out with any complex growth challenge. We'd be glad to help, and I'd love to meet you in breakout room 3.
Hey, thank you so much, John. We can move now to the next slide, where we have Health Improvement Partnership of Santa Cruz County.
Thank you. Good morning, all. My name is Amy Mancia, Operations Strategist at HIP. We're a nonprofit coalition based in Santa Cruz County who brings together public and private healthcare leaders. Our organization is rooted in systems improvement, quality relationship building, and increasing access to care to make our community and those across California healthier. Our TA team consists of staff with passion for human-centered design, quality improvement, and increasing access to services for those in need. We are partnered with several skilled consultants who we bring into our work to provide the most appropriate services for your organization's needs. And we offer both hands-on and off-the-shelf services in domains 3 and 7, but for brevity, in domain 3, we can work with your organization to develop a tailored hands-on project around managed care plan contracting and developing practices for organizations new to the Medi-Cal landscape to succeed in CalAIM implementation. Excuse me. Our off-the-shelf services lie in providing strategic planning and leadership coaching services to actualize and set clear attainable goals that enable organizations to lead differently and in alignment with ECM and community support services. Please do connect with me if you're interested in learning more. I'll be in breakout room 4 and my email is on the slide if you'd like to connect offline. Thank you.
Thanks so much, Amy. We can go to the next slide where we have Health Management Associates.
Good morning, everyone. I'm Steve Soto, Managing Principal for Health Management Associates out of our Sacramento office. Health Management Associates is a national healthcare consulting and policy analysis firm for almost 40 years now. In our California footprint, we have 4 offices and over 50 colleagues here, many of whom are experienced and well-versed in Medi-Cal and specifically CalAIM, now Medi-Cal transformation. We pride ourselves on having not only people who understand the policy and the program development at the department level, as some of us have been in those roles at the department, but also people who are operating with experience at the other end of the telephone, who have worked at the health plans, who have worked at FQHCs, the hospital systems, the community providers, the entities that are trying to understand and make the most of their opportunities in CalAIM. We are approved by the department and we're proud to be a TA vendor marketplace participant across all 7 domains. For this particular domain, domain number 3, engaging with the managed care plans, we are doing and have experience doing capacity building and identification projects, operational and gap assessments of a provider to assess their current state and where they need to be an ECM or CS provider. We have experience doing and are doing educational webinars and online training programs to help clients get to where they need to be a full participant in all that CalAIM offers. We have and are helping numerous clients right now participate and do what's necessary to apply to the health plans to pursue readiness as an ECM or CS provider front to back to get them into that process. Strategic planning for how to participate in CalAIM and take full advantage of all the funding opportunities that CalAIM affords participants or recipients in the TA vendor marketplace program. Helping these providers analyze and set up the right ECM or community support staffing models to support those services to comply with the health plan contract requirements and to do it in a fiscally sustainable way. We have populations of focus SMEs, community supports SMEs. We understand the reporting requirements the managed care plans have, and I look forward to chatting more with you in breakout room 6.
Thanks so much, Steve. We can go to the next slide where we have Health Begins.
Thank you so much, and good morning, everyone. My name is Alexis Taylor, and I'm a senior program manager here at Health Begins. I just want everyone for just a quick second to look behind me. If you look at my background, you're literally going to see a river that's looking upstream. And that's because Health Begins is literally an upstream mission-driven strategy and implementation firm. And we support Medicaid-serving organizations in not only meeting, but exceeding health and social needs requirements by utilizing equity-driven interventions. At every intersect that we touch, we always want to think upstream about the actions, strategies, and approaches that we're taking. And as you can see on the slide, we do this by supporting strategy design, implementing strategic action plans, launching and scaling initiatives, and driving both learning and improvement. We're a team with both expert and lived experience that has supported over 10,000 clinical and social service leaders over the past decade. And because CalAIM is quite literally an equity-driven initiative, our experience well positions us to support your team navigating both the contracting and implementation requirements of CalAIM. So if your team needs support with building sustainable cross-sector partnerships, improving contracting readiness to join the CalAIM network, enhancing data collection, building capacity, developing strategies to improve CS or ECM implementation, and a host of other needs, definitely join us in breakout room 1. Thanks so much.
Thank you, Alexis. We can go to the next slide where we have Innovation Horizons and Health Policy Matters.
Great, thank you so much. My name is Lucas Tramontosi. I'm the Senior Vice President for Innovation Programs at Innovation Horizons. where we provide professional technical advisory services that optimize organizational performances through the use of innovation methods, data applications, policy analysis, and business strategies. Our expertise in business consulting includes healthcare, value-based care, public health, social services, educational services, and information technology. We and our partners support a broad array of clients, including state and local government agencies, commercial and nonprofit entities, and federal government programs, and state programs through contracts and grants. Working with our partner Health Policy Matters, we specialize in delivering culturally and linguistically appropriate services with a focus on Medicaid and dual eligible populations. And we also have the expertise in integrating medical, behavioral health, long-term care services, and social supports. We really look to help clients navigate these complex healthcare landscapes, whether it's in urban or rural settings, and building upon our experience and success in offering similar services in the Massachusetts marketplace and our experience in Medicaid consulting. We're really excited to bring these strategies to CalAIM and to be able to work together with you to create person-centered solutions for better health outcomes. I look forward to speaking more with you in breakout room 2. Thank you.
Thanks so much, Lucas. We can go to the next slide where we have Intrepid Ascent.
Hello, good morning. I am Alexandra Milliton with Intrepid Ascent. We are a strategic consulting partner for community health transformation. We provide capacity building and technical assistance to community partners from healthcare, government, human services, housing, schools, and allied sectors for collaborative design, governance development, and technology guidance. We seek to help achieve community health transformation through collaborative approaches to people-centered care at the local level. Our TA services cover the spectrum of technology adoption needs, from assessing and creating implementation plans, establishing frameworks for community and data governance, procuring and implementing solutions, and designing workflows to enable cross-sector care coordination, analytics, and data exchange. Whenever possible, we promote shared local infrastructure that delivers value across multiple programs and initiatives. Organizations that may benefit from our technical assistance include CBOs who are contracted with the health plan for the first time, ECM or community supports providers navigating CalAIM requirements, and organizations looking to improve their compliance posture and or technology infrastructure. If you're interested in learning more about how we can work together, I encourage you to join us in breakout room number 5.
Great, thanks so much, Alexandra. We can go to the next slide where we have Maeda Consulting.
Hi, I'm Katie with Maeda Consulting. I am the Maeda in the consulting. We are an extremely small organization that really sets us apart because you get a personalized touch. And we are extremely passionate about doing things different. CalAIM is fixing a system we know has been broken for a really long time, and we want to do it right. And so we capitalize on developing systems, making things efficient, making things as wonderful and fast as possible for you, your leaders, and especially the people that you are working with. We support the helpers who are helping the helpers. So we want to make systems that are evidence-based, filled by motivational interviewing, trauma-informed care, harm reduction, so on and so forth, that is integrated in everything that you do, from your application to the way that you work with people in order to help your staff thrive. We have been known to bring back at least 20% of your time just by making efficiencies happen. That's what we do well, and that's what we love, and we're super passionate about. So if you want to hear more, we're in breakout 3.
Thank you so much, Katie. We can go to the next slide where we have Open Minds.
I guess it's my turn. Hey, this is Richard Lewis. I am VP with Open Minds here in the Western region in Los Angeles. And really quickly, I got 60 seconds. Open Minds is a national market intelligence and consulting firm. We've been operating for over 35 years. We specialize in working with payers and providers in health and human services. The list on the left-hand side are the focuses of all of our services, not only on the market intelligence side, but on the consulting side. We have been working with provider organizations here in California for the last 3 years, even before PATH, dozens of provider organizations on preparation and implementation of ECM and CS. We provide the managed care operational readiness assessments for organizations and the technical assistance to be able to successfully deliver services under managed care contracts, especially for those providers who've never worked with health plans, performance-based service line development. We did financial analysis with providers for rate development under VBR, like case rates, the profitability models for sustainability of not only ECM as a new service line, but as it fits into the organization and the other services. We do the complete contracting process and partnership development with the managed care plans, including meetings for negotiations. We do the market plan development for our providers to make sure that they have a way to grow enrollment for enhanced caseloads, and we also do the revenue diversification strategy development to maximize all revenue streams, not only ECM under managed care, but our county contracts under payer reform, as well as commercial health plans. All of our consultants come from these domains on the left-hand side, in the health plan side or on the provider side. I'd love to talk more about what we do. I'll be in breakout 4. Sorry if I went over, Jenna.
No, thank you, Richard. We can go to the next slide where we have Quantified Ventures.
Hi, I'm Chester with Quantified Ventures. QV is a social impact consulting firm. We work with CBOs throughout the state, and we support ECM and CS providers that are looking to create financially sustainable programs with MCPs. So we sit at the crossroad of really high functioning, high value CBOs and MCPs, and create impactful programs and sustainable financial models that work for those programs. So some of our offerings that you'll see up here include some off-the-shelf products, as well as custom TA projects as well, including financial sustainability analysis, program model assessments, and ways to maximize your overall outcomes of your programs. As I said earlier, we develop these innovative and unique partnerships with you as the provider, as well as the MCPs, not just in large CBOs, but also smaller, more rural CBOs as well. We have the ability to help navigate some of those complexities of the entire CalAIM project. I'll be in breakout room 5, and we can talk a little bit more, but that's all I have.
Thanks so much, Chester. We can go to the next slide where we have Rocket Doctor.
Hi, everyone. My name is Ashley Kirk. I'm the Director of Medicaid and Medicare here on behalf of Rocket Doctor. So Rocket Doctor is a platform and marketplace that integrates AI-fueled software with Bluetooth-enabled medical devices to match Medicaid patients to the best clinician possible. So in terms of TA marketplace services, we can partner with systems of care to be an added to expand access to care for Medi-Cal populations through our own network of primary care specialists, behavioral health physicians, and virtual care, and that's through our California practice group. We can also work with public hospitals and other health systems to help expand access to care through ED diversion strategy. So to date, we've seen over 300,000 patients across North America, have worked with 400 MDs that are powered through our platform, have hubs in Los Angeles, New York, and Canada. And in California alone, we've powered over 6,000 appointments the last year, have connected 300 plus Medi-Cal patients to virtual care services, have also connected them to community health workers as well through our system integration, and are really excited to work with you all. I will be in breakout room 4. Thank you so much for your time.
Great, thanks, Ashley. We can go to the next slide. We have Sherry Brenner, Health Systems Consulting.
Wow, it is so amazing and humbling to be part of this group of so many skilled individuals and agencies. Clearly, there's a ton of competence in the room. I'm going to focus on the why. I am here because I think the vision of CalAIM is brilliant. Client-centered services that make a difference is what I want to work on. And I look forward to turning around 1, 2, 5, 10 years from now and saying, wow, look what we all did together. I'm a very hands-on independent consultant with decades of leadership in public health programs, having worked in CBOs, clinics, county and state government. I started an ECM program that operated in 2 different counties, reporting to 2 different managed care plans. And so I learned from the inside what it takes, and I've also engaged in the community discussions, learning about different challenges from others. My commitment is to support the implementation of CalAIM in any way that I can to be part of making the vision come true. And I would love to help you find your place in this brilliant, yet complex and messy new world. I will be in breakout room 2 and look forward to meeting you. Thank you.
Thank you so much. And I think that might bring us to our last vendor, which is True Management Services.
Hello, everybody. Sergey Shkirkin, CEO and founder of True Management Services. Since 1994, True Management Services' mission has been to identify and secure financial resources for community-based organizations and local governments. Since 2021, we've assisted agencies to become CalAIM contractors. As of January of this year, True Management Services is the leading vendor working in the TA marketplace. Out of 127 approved statements of work, 73 or 57% are with True Management Services and their clients. The basis of our TA marketplace success is a combination of 4 domain 3 off-the-shelf projects that together take an organization from starting the contract to delivering services and building for them. The off-the-shelf projects combine workshops with one-on-one TA. Starting this month, we're offering 2 new domain 3 off-the-shelf projects, 220 hours of expert grant writing assistance for PATH, cited and IPP grants. You got to love that one. Support for agencies as they launch into serving individuals transitioning from incarceration population to focus. If you want to learn more, join me and members of the True Management team and breakout session 7. I think that's 1 minute. Thank you.
Thank you so much, Sergey. And thank you to all of our vendors. We greatly appreciate, I know it's very tough to give a 60-second overview of your organization. We can move to the next slide. I did notice a few questions in the chat. We will be sharing the slides. So all of the great information that was shared as part of that, all those vendor pitch slides will be shared with all attendees following the meeting. So before we move to the breakout room sessions, I do just want to press on a little bit of logistics regarding those breakout rooms. So if we can move to the next slide. Alrighty. So the breakout rooms are really an opportunity for all attendees to ask questions of specific TA vendors and hear more detail about their projects and services within domain 3. Once you move into the breakout room, you will have the option to raise your hand, and we ask that all attendees use that raise hand feature to ask questions. There will be a member of the TA Marketplace staff in each of the breakout rooms, and they will be in charge of doing some introductions and then also just calling on attendees with those who have their hands raised. Once you are called, you will be able to come off mute using the mute button and ask your questions. We do ask, in order to maintain some noise levels and ensuring that we're not having too many people asking questions at once, that all attendees remain muted until you have been called on. Again, please use that raise hand feature. Messages will be sent to all breakout rooms at the 5 and 1 minute marks, as well as when the breakout rooms will move to the main room. When those breakout room sessions are closing, you will be automatically moved back into this main session, where we will be concluding with just a few more highlights about the TA Marketplace, as well as opening for general Q&A about the TA Marketplace. And again, I am going to do one last push to make sure that you have the Zoom application downloaded to your device in order to successfully participate in those breakout rooms. If you have joined by phone or browser, please take this time to join via the Zoom app. We can go to the next slide.
Jenna, you have
Sorry, yep.
Oh, okay.
Thank you.
Yep.
When those breakout room sessions open, you will be automatically assigned, so the attendees will be automatically assigned to a breakout room. However, you are able to move throughout breakout room sessions in order to visit multiple TA vendors. So to move between the breakout rooms, at the bottom of your screen, when those breakout rooms open, there will be a button for breakout rooms. It'll be kind of near that raise hand feature. And then a pop-up will appear with a list of the breakout rooms, and you can click join at the breakout room that you wish to join. And so if we move to the next slide, you will see those breakout room assignments. So we do have 8 breakout rooms where there are 2 to 3 vendors in each room. During those breakout rooms, we do have a similar slide that has these details, as well as asking you to use the raise hand feature and a little bit of instructions on how to move between breakout rooms. So in case you want to move between those and visit a different vendor, you are able to do so. Additionally, my colleague Danielle will be in the main room if you're having any technical difficulties or trying again to find that breakout room that you're looking for. She will be able to help you in that main room session. And all right, I'm just going to check the Q&A feature just to double check I don't have any questions regarding logistics. And if not, I'm going to ask for Danielle to open those breakout room sessions and ask that the vendors to be sure to join that breakout room for which you are assigned when those sessions open using the More button and going to breakout rooms.
Great, thanks, Jenna. I'm going to go ahead and pause the recording so we have the first half saved here.
Much, Danielle. All right, so we can move to the next slide. So we did just want to highlight some of the resources that are available on the TA Marketplace website to help you in navigating this process as well as navigating the marketplace itself. We actually just recently underwent a new revamp for the website, so we're really excited about some of the new features we have, as well as a lot more information, hopefully to help you all apply to be a recipient and get those TA projects funded and started. So this is just the homepage. This is where you can find a lot more information in general about the marketplace, about the experienced vendors, project types, these project domains. And then we also include a step-by-step process for how to become a TA recipient and get those TA projects started. You can visit it using the link there. We will also be, again, sending these slides out to everyone, so you will have access. We also have our inbox, which is the TA-marketplace@ca-path.com. The TPA, so PCG, are the folks that respond to those emails, several of which you saw in those breakout rooms. So please reach out to us if you do have any questions. We can go to the next slide. All right, and so we're really excited to share some of the new features, one of which are these vendor profile cards. So this is a new feature, part of our website. So if you navigate to seeing more about the vendors, you will see a little blurb about each vendor up here on your screen. So for example, we have Cope Health Solutions here, which was a presenter today. You will see a little blurb about them, see the domains for which they are approved, and their contact information. And if you click on their name, you will be able to see a more detailed vendor card that includes more information about their organization, the services they have, including those domains for which they are approved, and offer those hands-on, more targeted projects, as well as the off-the-shelf projects which are more curated and have been approved through our team. There's also client testimonials, so you can hear a little bit more about those organizations who have worked with these vendors, as well as contact information there on the left side. All right, if you can move to the next slide. All right, so now if you are ready to look at the marketplace and find your vendor, find your project, going to the TA Marketplace website and clicking Explore the Marketplace is where to go. So if you click Explore the Marketplace, it's at the top of every page of the PATH website. It'll take you to a long list of either off-the-shelf projects or hands-on options for vendors. So in this example here, we see that the first project that comes up is for an off-the-shelf project, and this is from Intrepid Ascent, Technology Procurement Management. You'll see just a little bit of blurb about the project itself, what domain it's part of, the expected duration. And then if you click on the actual name of the project, you will get a lot more of those project objectives that have been reviewed by the TA Marketplace team. So if this is a project that you are really, aligns with your goals and your needs, this could be a really good option for you. But another option is if you see right below the off-the-shelf project that is highlighted, you see an example of a hands-on vendor card. This again will take you to those vendor profiles, give you a little bit more information about the vendor. And again, you can apply for those more curated projects through a hands-on project. And if you go to the next slide, Just another way in which you can explore the marketplace are our new TA marketplace filters. So we have filters that have been added to the website. We have asked each vendor to tag their projects, tag their hands-on services with at least up to 3 different tags. So those are broken down by the TA need, the population that it serves, ACM and community support services that it matches with. So if you have a specific idea in mind of what you're looking for and you really want to filter down to find that great project or vendor, you may use those filters. Or also maybe you really had a great experience with one of our vendors that presented today. You can click on find a vendor, search for their name, and you'll be able to see again that vendor profile card and all of their offerings. All right, I think we can go to the next slide where I think we're going to open it up for Q&A for the last 5 to 8 minutes before our closing. And Trish is going to lead us here in that today. So Trish, I'll pass it to you.
Absolutely. And I want to start with a question we got in the breakouts and in the Q&A function. So, you know, a good one, a question all around, and that's, are these services free? Yes. If you are a registered recipient on the TA Marketplace and you request the services through the TA Marketplace using the project eligibility application, those contracts with the vendors are paid for through the CalAIM initiative. So CA Path Initiative is going to pay for it. You as the recipient do not pay $1. You do not have to give the service, give the funding to the vendor. PCG as the third-party administrator handles that. We try to make it as easy on you as possible to receive these services. And I see in the chat, are these services time limited? Yes. So we are looking to deliver TA that's going to help you to move your organization in the direction where you're going to be able to contract with MCOs, MCPs, and you're going to be able to deliver high quality services. So we're not, the TA is not staff augmentation. It really is meant to be time limited technical assistance to get you where you need to be. But that said, the length of the service is determined between you and the vendor and approved by DHCS. Perfect. Great question. How do you find out if you're available, if you're eligible to receive these services? Submit an application on the TA-Marketplace website. So it's ca-path.com. Navigate to the TA Marketplace and submit an application. The application process is very simple. We ask what kind of organization you are. We do a identity verification on you. And then we ask you to submit an attestation. If you're working with a plan, it's going to be your contract cover sheet and attestation. If you're not working with a plan, you're going to reach out to us at ca-path.com or TA-marketplace at ca-path.com. And we're going to get you an attestation if you are eligible so that you'll be able to sign up on the marketplace and shop. So it really is that simple. See. Oh, great. Questions about turnaround time. So when this TA Marketplace opened, it did take quite a while for us to move through the approval process on these projects. But as some of our vendors have told you in the breakout rooms, now that we have approved these projects in the past, especially the off-the-shelf projects, we have been able to reduce the turnaround time significantly. So from the time your PEA is submitted, especially if it's for an off-the-shelf project, it takes about a week for it to move to the next stage, which is submitting the scope of work and budget. And then once that scope of work and budget is submitted, it's 1 to 2 weeks. So it can be as quick as 3 weeks between that PEA being submitted and you being able to execute on your project. Do you have to be a nonprofit agency to be eligible? No, you don't. Really, any organization other than an MCP that is planning to or is currently delivering ECM or community supports can apply for TA through the marketplace. So if you are planning to deliver ECM and you know you need TA, the TA Marketplace is the place for you. And there is no deadline to apply. So we're getting some great questions in the chat. I really hope this is helping. There's no deadline to apply. So for cited grants, for those of you who have applied for cited grants, we open different rounds of funding. If you miss the round, you have to wait. That is not true of the TA marketplace. It is open at all times. So sign up as a recipient and you can submit PEAs as soon as you realize you need the help. As soon as you identify a vendor, you can submit that PEA. There's no waiting. Yeah, so the difference between timeline for hands-on versus off-the-shelf approval, it can add an extra couple of weeks. And the reason for that is we really need to understand that the TA has clear goals, clear outcomes designed. And often what happens is when a hands-on application is submitted the first time, those are not immediately clear because it's a project that's never been submitted before. So we have to work with a vendor and work with you, the recipient, to make sure we have clear goals and clear outcomes from the project before we can have it approved by DHCS. Great questions here. What is the typical length of time for services? So there is no typical length of time. We have some projects that take a day. We have some that take a week, and then we have some that are slated for 11 months. Typically, we would say under a year is really the goal for these TA projects, but they can be as long or as short as required so that you receive the TA that you need. And I want to make sure I answer this one. Is this available to jails and correction agencies? As long as you are delivering ECM or community supports, then yes, you are absolutely eligible.
We did receive a question about if recipients can reach out or organizations to vendors before applying, and we do actually specifically also before applying for an actual project. We do encourage you reaching out to the vendors to get those project goals aligned in the vendor to make sure that they have their scope of work and budget ready and the capacity to do that project. So thank you for that question.
Yeah, and all of the contact information for each of the vendors is on that vendor contact card on the TA marketplace. So as you're shopping, you can shoot them a quick email and just say, hey, here's my situation. Here's the population I serve. Here's what I'm looking to do. Are you a good fit as a vendor? And instead of filling out the whole application, they'll give you the information that you need. And hopefully you can work together to create your goals and the outcomes. Oh, and I do want to clarify, you do not need to be contracted with a plan before you receive TA services. That was true in like when the marketplace first launched, we were limiting to off-the-shelf projects related to contracting, but now the marketplace is wide open. If you are contracted with a plan, if you are negotiating contracting with a plan, or if you have an option 3 attestation signed by DHCS saying that you are eligible for services, you can receive any TA on the TA marketplace. So there's no limitations on contracting with or receiving services from these vendors prior to contracting with an MCP. You can sign up today and receive services. And, you know, just to that point, another question here, is TA appropriate for an organization still researching how to participate in CalAIM? Yes, but I just want to point out that we are soon to be launching on our website on-demand TA. So there's no vendor direct contact for on-demand resources. They are toolkits, they are guides. So if you're looking to explore whether or not working with CalAIM is for you, we would recommend starting with those on-demand resources. But in the interim, before those go up, you can still become a recipient on the marketplace and reach out to a vendor to receive that TA.
And Trish, I do just want to note the time. We are at about a minute before we end, and I do want to get to some of just our closing remarks. But we will be working through any of the questions that we were not able to answer, as well as you do have any questions, you can always email our team at ta-marketplace@ca-path.com. And again, you will be receiving these slides after the meeting. And if we go to the next slide, We just wanted to highlight that we do have some more of these events coming soon. Focus again on those different domains. If you want to learn more about those domains, please visit our website. Again, and the registration links are linked here, so we'll be able to share that with you. Registration is also available on our homepage if you just go to upcoming events at the very bottom. So we look forward to seeing you all there. If we go to the next slide. We will also be sending you all a survey for today's event. We really want to be sure that we're making these events to meet the needs of organizations like yourselves and ensure that they are meeting, allowing you to match with different vendors. And it also just will help us get an idea of future events as well. So this survey is available right now, but will also be shared when we send the slides to all attendees. And I think with that, if we go to the next slide, we just want to thank you again for your time. We do have the contact information, that email that I noted before. That is the best way to reach our team with any questions. We really look forward to working with all of you. And again, want to thank our vendors who are here today for their participation and engagement. And we hope that it was a successful event and to see you all on the TA Marketplace. And with that, I think we can conclude today's webinar. Thank you, everyone.
Thank you, everyone.